today we have a guest who scored All India 110 in NEET MDS 2021 and 327 in INI CET exam. Dr. Param Shukla. He is a very studied person yet a very cheerful.
Thank you, Dr. Rohan.
Many congratulations to you.
Thank you so much, Dr. Rohan. Thank you for your introduction.
Yes. And so tell me, Dr. Param, how was your experience with these exams?
INI CET and NEET MDS both are all India level,
Yes.
very high level exams, as we all know. So after giving both the exams, after getting very good results, it's a satisfying feeling for me, of course. I worked hard for 1 year for both these exams and got the good results for which I was preparing so much. So very happy for that.
And very good result you got. Yes. So how's the feeling when you got the result, like you were in top 100 in NEET MDS, like 110th rank is a very high rank. So how was your feeling when you got the results?
I was amazed with my rank 110 in NEET MDS. I was expecting a good result, but of course I was not expecting 110 rank. So it was a happily surprising for me. I got decent rank in INI CET 327, but so after that I believed that I can get even better in NEET MDS and get a good government seat for which I was preparing.
INI CET, like it gave a boost to
it gave a boost to my preparation in last 1 month. I was my confidence level was also elevated after getting a good result in INI CET. So INI CET was a practice ball for me and it worked good for me.
Yes. And one thing, like generally the students are facing this issue that generally like what happens that they couldn't get the time to complete the whole exam. Like can time कम पड़ रहा है ऐसा होता है. So how are your time management was?
First we will talk about INI CET. So we got 200 MCQs in INI CET, and many of them were multiple options MCQs, right? So we have to match options after evaluating the question. We have to match the options. Yes. So it was a time taking. I marked 176 MCQs in INI CET. In first attempt I managed to mark 150 odd, and as you told that time कम पड़ रहा है. टाइम मुझे भी INI CET में थोड़ा सा कम लगा था क्योंकि लास्ट में रश होने की वजह से I marked 176. I was targeting 180 or 185 MCQs, but okay. And after the aims in NEET, I was prepared that वहाँ पे 200 में अगर 3 घंटे में प्रॉब्लम हो रहा है तो फिर 240 क्वेश्चंस है यहाँ पे. और इस साल का नीट का एग्जाम हमें पता है कि इट वाज अ डिफरेंट पेपर और ऑलमोस्ट बहुत सारे 150 MCQs सिनेरियो बेस्ड और क्लिनिकल क्वेश्चंस बेस्ड हो गए थे, बड़े MCQs.
इट
वाज अ लेंथी पेपर. सो उसके लिए मेरी यही स्ट्रेटेजी थी कि आई कांट अफोर्ड टू रीड द होल क्वेश्चन for every MCQ. So I was seeing the options, then some key words which are given in that whole big question. So 3-4 चीज़ें हर एक क्वेश्चन में दी हुई होती है जो आपको सजेस्ट करती है कि ये किस टॉपिक से पूछा गया है या किस डायरेक्शन में क्वेश्चन जा रहा है. सो उस हिसाब से इवेल्युएट करके we can think accordingly to get the faster answer.
You need to find the keywords in the question. And
yes, you have to find the keywords in the question because you can't afford to read the whole questions because there are 240 and of course the time is 3 hours, so you have to manage.
Yes, that's true. And like it's your first attempt and you are preparing very well with your clinical postings and internship ongoing. So tell me that how your preparation was, how you started your preparation, and everything.
I have started my preparation from November 2019. At that time, my internship was ongoing. My clinical postings were ongoing, so I managed to spend 4 or 5 hours per day at home after my college clinical postings. So it was, of course, it was not enough for me to get a good rank in All India exam. But after the lockdown in March, I got good time from April to December. So I used that nicely. I got 8 to 10 hours a day. I was reading consistently during that 6-7 months. So that consistency also helped me a lot, because after in if I have not studied the whole year, in last 3 months it's very difficult to catch up the things in such a short period. So you have to be very consistent in your preparation. Consistency is the key, of course.
And how is your reading pattern? Which books you are preferring, and how is your reading? Like it's a conceptual base or more of a top-height base, or what is the planning of your the reading whole?
Yes.
You have
So
started?
I was reading. First, I'll tell about books. So I was reading Dental Pulse, Neeraj Wadhwan, then AIMS 25. Then for medical basic subjects, I was using Arvind Arora and our standard textbooks as well for some important topics, or to see some pictures and diagrams. Textbooks was also in my preparation. Um, I was reading first the synopsis, then I used to solve the MCQs of Pulse, then the past 10 years papers from Vadwan, then AIMS papers, and lastly some important topics which should be covered for the preparation, and which help me in clearing the concepts, which will help me to solve the conceptual questions. बिकॉज वी हैव सीन कि हमारे नीट के एग्जाम में काफ़ी क्वेश्चंस कंसेप्चुअल बेस्ड ही पूछे गए.
It's completely changed to the concept based questions.
Yes, and I finished my first round of preparation till June end, I think. So I was more on revisions, because मेरा एक बार मैं पढ़ के याद नहीं रख पाऊंगा, क्योंकि आई हैव 19 सब्जेक्ट्स, राइट. और एग्जाम में ऐसा नहीं है कि अलग अलग दिन एग्जाम है और रिवीजन करने के लिए टाइम है. एक ही दिन में 3 आवर्स में 19 सब्जेक्ट्स रिकॉल करने हैं. इसलिए मैंने 4-4.5 मंथ्स रिविजन्स के लिए रखे थे. उसका बहुत बेनिफिट है. रिविजन्स करने के बाद ही आपको कॉन्फिडेंस मिलेगा, क्योंकि एक बार कोई भी चीज़ पढ़ने से वो कभी भी याद नहीं रहने वाली है. वो पढ़ी हो या ना पढ़ी हो, एक ही चीज़ होगी. ठीक है. अगर रिवीजन नहीं किया है तो फिर एक बार में कुछ भी याद नहीं रहने वाला. इसलिए रिविजन्स आर आल्सो बिग थिंग.
It's like you are storing it in a short term memory, but you have to hammer those things in your mind to make it for long memory.
Yes. Revisions are the key.
Yes. And how are you tackling those difficult subjects? Generally finding the difficult medical was generally on the difficult side.
Yes.
So how are you managing those subjects?
See, every subject is not similar, right?
Yes.
You have pharmacology, then medicine, then surgery. These all subjects are very much important, and उसमें से MCQs भी ज़्यादा आते हैं. 15-20 MCQs आते हैं, और उसके कंपैरिजन में बायोकेमिस्ट्री है, माइक्रोबायोलॉजी है, ये सारे सब्जेक्ट से इतने ज़्यादा नहीं पूछे जाते हैं. हार्डली यू गेट 5 or 6 MCQs. So you have to plan accordingly. You can give more time to classifications of pharmacology, or clearing your concepts of general medicine. Like if you are reading general medicine, you can compile it with general pathology and physiology. So you get an overview or a complete idea of the whole thing. Like it's not like कि ये चीज़ अलग है, फिजियोलॉजी अलग है, मेडिसिन अलग है, ऐसा नहीं है.
That's true.
हाँ, वैसे ओरल कैविटी एक चीज़ है, डेंटल सब्जेक्ट्स 8 होते हैं, लेकिन एक साथ ही देखेंगे हम तो वो इजी होता है. इसलिए आई यूज टू read the similar topics of different subjects together, like endo and pedo. At some point they are overlapping in pulp therapies, and ortho and pedo is also overlapping in space maintenance or space maintenance.
Yes, and that things are giving you more base for the concept based question.
Yes,
it makes it easier.
That clears the concepts and saves your time as well. In less time you clear the more concepts and you get more time to do the difficult things, or there are some things which you have to mock up. There is no other option. You have
the dental material
properties हैं, फिर बायोकेमिस्ट्री के कुछ साइकिल्स होते हैं, वो सब मॉक अप करने ही पड़ेंगे.
And anything special that you have done for the image based questions?
No, I have not done anything special for that, because there are no books special for the image based questions separately or clinical scenario based questions separately. So as I told you, I was reading the standard textbook and seeing the images which was given very good, like in oral pathology you have slides in the MCQs. You got slide in the MCQs, so you can see them in the shapers. They're nicely given. In we have seen in INI CET paper, we got almost 10-15 MCQs of sections for anatomy. So for that, for anatomy, I have seen the pictures from Gray's Anatomy. They are very nicely given, colorful pictures they have given. So it helped me in clearing the concepts of anatomy as well, and उसको रट्टा मारने की फिर ज़रूरत नहीं पड़ती कि अगर कोई आर्टरी जा रही है, उसकी कहाँ से ब्रांचेस होंगी, किस ब्रांच से कौन सी टर्मिनल ब्रांचेस जाएंगी, ये सब इमेज बेस्ड देख के आपको याद हो सकता है,
समझ जाते हो ज़्यादा इजीली.
हाँ, इसलिए स्मार्टली आप इमेजेस को देखकर भी अपना टाइम सेव कर सकते हो, ज़्यादा याद कर सकते हो.
That's a great thing. And thing like what are your thoughts on the test series, like our test series internship, or in general taking test series? What is your preference? Would you like to take test series, or and in your experience it's okay to escape from the test series and keep it to the books? Like what is your
I think tests are the essential part of your preparation. I have given almost 30-35 full course exams before the NEET exam. You have provided a great platform for all of us to give the everyday exams. You put the daily boosters and 30 full course exams. So it helped me a lot. So thank you so much for that also.
It's our pleasure to have you for that matter. And at the last of our session, would you like to share some motivation or some insights of the exam to our future aspirants?
Yes, so the motivation is you are already a graduate BDS student, and why you are doing MDS? You are doing to learn some new things or to develop a better skill in some particular branch you love. So in the government college you get more patients, of course, than any other self-finance colleges. So getting admission in a government college helps you training or building your skills better, right? As well as you get a good stipend also. Money matters a lot. Everyone knows that, right?
The stipend is very good.
Yes.
That gives you the initial boost when you come out of them.
And it gives you a more confidence also. Like if you are targeting something in your life, or doing something for 1 year to achieve that particular thing, and you are achieving that thing after so much hard work, it obviously gives you so much confidence. So that is the only motivation for all the aspirants.
And thank you so much, Dr. Param,
Thank
for
you.
being here with having great session with us.
Thank you, Rohan.
And we wish that you will get the you were going to get the very good government college. We wish you will get your desired branch in very good government college,
Yes.
and you will exceed in
Yes.
that branch.
Yes.
And
Thank you so much, Rohan.
yes,
Thank you for
Thank you.
inviting me here on your platform. Thank you so much.
It's our pleasure, really. Thank you so much, and thank you for listening. Have a good day.